Welcome to Infection and Immunity Evidence Explained, a Doherty Institute podcast. I'm Rebecca Elliott. In December last year, the World Health Organization European region announced a 30-fold rise in cases of measles from the previous year. Despite being vaccine preventable, outbreaks of measles are currently occurring in every region of the world, with many countries reporting their first case in years. In Australia, the disease was considered eliminated in 2014, but a series of imported case alerts begs the question, do we need to be concerned? Joining us today to shed some light on the situation is the Royal Melbourne Hospital's Dr. Catherine Gibney, an infectious diseases and public health physician and medical epidemiologist at the Doherty Institute. Catherine, thanks so much for joining me on Infection and Immunity Evidence Explained.
Thanks for having me.
So firstly, what is measles?
Measles is an infection caused by the measles virus, and people develop a fever and a rash that's quite characteristic. And sometimes it's more severe than just that, and people can develop chest infection, pneumonia, diarrhoea, occasionally inflammation of the brain, and end up in hospital. The other issue with it is that it can affect the immune system and can get additional bacterial infections on top of it that can be quite severe.
We've been receiving a few health alerts across Victoria in particular recently, where we've touched on where people have been, at a train station or whatever. So, in terms of infectiousness, how long do I have to have been in proximity to a person who has measles for me to potentially contract it if I'm not vaccinated?
It's really one of the most infectious viruses. So you hear stories where it's, almost walking past a room where someone with measles is and it's enough. There are guidelines in terms of public health around, following up people who've been somewhere for a period of time, but really it can be a very short period of time. It's droplet spread. So you just need to be in an area at the wrong time and be unlucky.
So we know that it's extremely contagious. So just how severe can it be?
Well, reasonable proportion of people with measles, particularly children, end up in hospital. So everyone who gets it is pretty miserable. It's not a fun illness to have. But quite a large proportion of children end up in hospital and can die from measles. It does kill a lot of children in the developing world, and that's likely compounded by nutritional deficiencies, particularly vitamin A deficiency, which can make measles much more severe.
Once you have measles, what can we do to treat the disease?
So there's no specific treatment for measles. It's one of those diseases where you just have to wait until you get better. Some people end up in hospital and we can support them. So if they, can't eat and drink, we can give them fluids. If they need, their blood pressure needs support, or if they need oxygen, all of those kinds of things we can do, but we don't have an antiviral treatment for the virus. As I mentioned earlier, you can get what we call a secondary bacterial infection, and so we can give antibiotics if someone has that. And, that's what often kills people from measles, is these sort of secondary infection you get after the measles. So certainly there's a lot that can be done, but we don't have a specific treatment for the measles virus itself.
Measles cases are rising around the world. So what factors are contributing to its resurgence?
Well, measles is a vaccine preventable disease, and we have a really very effective vaccine for measles. So really the thing that's underlying the resurgence of measles everywhere is low vaccination rates.
What are some of the factors that are contributing to these low vaccination rates?
So for many places it's literally just a disruption in health systems, loss of healthcare workers or people moving out of the sector, resources being diverted elsewhere, funding not being available for these programs. That explains it in some places in the world, but in places like Australia and other high-income countries, it's maybe a little bit more complex than that in some ways, in that there's probably been a shift in attitude toward vaccines in some parts of the community. So some people have become a lot more conscious of vaccines and much more supportive and proactive about vaccines. But some people are a bit sick of being told to be vaccinated and have more questions around vaccination. So maybe a little bit less confident in just turning up and getting children vaccinated, which we have done for so well for so long in Australia.
And what role do you think COVID-19 has played in that?
Well, COVID's been obviously completely disruptive to many aspects of life, but particularly to health systems and to vaccine programs. And we have seen that in Australia, but it's a lot more so in countries where the health system is less well funded and less well established than it is in Australia. So unfortunately, there are millions and millions of children in the world who now have not been vaccinated against measles at all.
So reported cases in Australia have predominantly been imported. So that's from people who have bringing it in from other countries. But is there a risk of an outbreak here in Australia?
There's certainly a risk that some people who haven't travelled will get measles, and we would expect them to be either unvaccinated or under-vaccinated, as in only having received one of the 2 doses of measles-containing vaccines. So, back in 2014, the World Health Organisation declared that Australia had eliminated measles, and what that means is that our vaccination rates were high enough that even if someone with measles came into Australia, it wouldn't spread very far. Now, our vaccine rates have drifted down a little bit. So if someone comes in and they're infectious with measles, there's a chance they'll come across someone who's not vaccinated, not protected, and that person will become infected. So that can certainly happen, and it has happened, where you might get 1 or 2 cases that are locally acquired. But we just can't be complacent, because there are other places in the world, the UK being a great example, where measles is really spreading within the country, and they're not imported cases.
And that's because of the low vaccination rates?
Absolutely.
Yeah. So are vaccines the most important tool we have against measles?
Vaccines are really the only tool we have against measles.
And what role does herd immunity play in controlling outbreaks?
Yeah, so measles is probably the disease we think of most when we think about herd immunity. So in Australia, we have a target that at least 95% of children will be vaccinated. That's our sort of coverage target, and usually we meet that quite comfortably. And that figure is from measles, because it's so infectious that you need the vaccine rates to be that high to be sure that an individual who hasn't been vaccinated, and that might be because they're immunosuppressed and they can't receive the vaccine or can't respond to the vaccine, that they will be protected, because the virus will just come up against vaccinated people and it won't spread through the community.
So how old are you when you actually get the measles vaccines?
So there are 2 doses, and in the Australian schedule they're given at 12 months and 18 months of age. If necessary, it can be given younger, so it can be given down to 6 months of age. But if a baby does get vaccinated in that 6 to 12 months, for instance, if they're going to travel, they still need to get the 2 usual doses to be considered fully vaccinated.
And then are you fully vaccinated for life?
Yes, you are.
Yeah. In 2019, you published a paper in the Journal of Clinical Infectious Diseases which showed that 13 people in Victoria contracted measles between 2014 and 2017, even though they'd received at least 1 dose of the vaccine. Can you tell me about this paper and your findings?
Yeah, so that was quite interesting, and it came from sort of observations at the hospital that occasionally people would come in who were pretty sure or had documented of at least 1 dose of measles vaccine, and also at the health department that they'd noticed this. So we reviewed all the cases in Victoria and their vaccination status, and because measles is uncommon and it's one of the diseases that the health department really follows up and tries to make sure it doesn't spread, we had good information about people's vaccination status. So we know that some people are protected with just 1 vaccine dose, but some people need the 2nd dose to be protected. Even with 2 doses, I mean, nothing's perfect, and maybe 1% or so of people who have 2 doses might still get measles if they're exposed. But one thing we did find in that paper was that people who received 1 or 2 doses and got measles had really quite modified and mild disease. So even though it wasn't 100% effective against contracting measles, it was very protective in terms of severe disease.
And what about then, so if you do get measles after 1 vaccine, you can still then spread measles to unvaccinated people?
Probably less so. So I think there might have been 1 case in that series where we thought it had spread from a vaccinated person to someone in their house, but nowhere near as infectious as it would be in someone who's unvaccinated. So that's another thing that's sort of modified and lessened by the vaccine.
Measles is a nationally notifiable disease. How important is the role of surveillance?
Well, it's really important, partly because we want to protect people against measles. So it takes a few days, 10 to 12 days after you've been exposed to become unwell with measles. So there's that sort of delay. But if we can find out that someone has measles and where they might have been at the time that they were infectious, we can have a look back and make sure that there's no one vulnerable around them, whether it's, you know, a baby who's too young to be vaccinated, someone who's immunosuppressed, someone who might not have received their 2 doses for some reason. And we can at least let those people know that, you know, they might have been exposed, and then they can either go out and get a vaccine, which can be protective even after exposure, or some very vulnerable people could get some post-exposure prophylaxis. So that's really one really important thing about surveillance, is just to try and protect people who might have been exposed. Another is just to make sure that we're not seeing measles emerge in Australia. Already, obviously, we're very conscious of telling people to get vaccinated, making sure kids are vaccinated, but if we had an outbreak of measles like they're having in the UK, we'd need to have really focused, you know, vaccine programs around that to try and prevent it spreading, making sure we don't lose our status as a country without measles.
So what do people need to do to protect themselves and their communities against measles?
Really, the most important thing is to check your vaccination status. And so all those alerts that have been coming out state that if you don't have documentation of 2 doses of measles-containing vaccine, you just need to, you know, turn up to your healthcare provider and they'll give you a dose of vaccine. And that's the easiest thing. You don't need to get a blood test to check. You don't need to, you know, think too hard about it. There's no problem with getting an additional dose. If you're not sure, go out and get that dose. And it's the sort of middle-aged adults who might have only had 1 dose of vaccine because initially it was a single dose course, and then we realised actually you need 2 doses. So that's for adults. Then we need to make sure that our kids are vaccinated with 2 doses. And so that's about, you know, proactively going out and making sure that your kids have been vaccinated, about programs to educate people and increase confidence in vaccination, make sure there are no barriers to people turning up and being vaccinated. And then, you know, making sure that our surveillance system is good enough that we diagnose measles, we let the health department know, and then we can have the chain of events that can identify and protect people who need the additional protection, who, you know, can't be vaccinated.
Like smallpox, we have the opportunity to eradicate this disease from the world. Is that right?
That's right, yeah.
All we need to do is vaccinate.
Yeah. It sounds simple, but it's not. And particularly in places where, you know, the health systems aren't as strong, and it's just much more difficult to get 2 doses of the vaccine into every kid, which is kind of what we'd need to really eradicate it entirely.
And what's being done globally to, I guess, bolster these health systems?
Yeah, so, I mean, individual countries are doing what they can, but there's a lot of programs through the World Health Organization and other sort of global organisations that support vaccination to really try and strengthen the systems behind vaccination, to make sure that there aren't countries that, you know, can't afford a vaccine program. So there is a lot that's being done to try and support that, but we lost a lot of ground in COVID and we haven't caught up yet.
Thank you so much for joining me today, Catherine.
It was a pleasure.
And thanks to all of you for listening to Infection and Immunity Evidence Explained, a Doherty Institute podcast. If there is a specific topic you would like us to cover, please get in touch with us by emailing doherty-media@unimelb.edu.au. That's doherty-media@unimelb.edu.au. If you've enjoyed our podcast, please rate and review on your favourite podcasting app and subscribe if you haven't already. The Doherty Institute is a joint venture between the University of Melbourne and the Royal Melbourne Hospital. See you next time.